When I had to choose my career, I didn't know what type of career I wanted to go into. I knew I was good at sciences, but I didn't know what I wanted to do. So I arranged some voluntary work experience at a range of places, and the one that really inspired me was working at a community pharmacy. I was just amazed at the wealth of knowledge the pharmacist had, how he knew the names and what the medicines did inside the pharmacy. There must have been hundreds of boxes of medicines, and he seemed to know everything about them. That, and when he was explaining what the tiny little tablets could do in terms of really improve a patient's life and potentially save people's lives, I was just fascinated, and I knew that I wanted to be, I suppose, the expert in medicines, and I wanted to have a positive impact on patients' lives. When I qualified, I joined community pharmacy, and my learnings never stopped. I went on to do a clinical diploma, which is a part-time whilst I was working full-time in community pharmacy, and I really enjoyed that, the clinical aspects of being able to help patients further. So I was able to offer several different services to patients as well. Then I took a different route. I decided to do management. So I did a step up to manager course, and that meant I became a leader of the store, but also very much part of the team as well. I was a manager for several years. But I felt as though my clinical knowledge needed to be updated because pharmacy is forever progressing. There was the opportunity for me to do an enhanced independent prescriber course, so that would allow me to actually prescribe and diagnose minor ailments for patients. So I did that, and that actually opened up so many new opportunities for me. I think the future for pharmacists is very bright. In my own career as a community pharmacist, I've been able to do several different types of services. I can do flu vaccinations. As an independent prescriber, I can run clinics in specialist areas. If I feel competent to, I can issue prescriptions as well. And I think it's forever evolving, the type of opportunities we will be getting. You get to spend a lot of time getting to know patients in community. They do very much feel like part of your family. You get to know them first name terms, you know their families, and they know you. And whenever they do need any information, they can walk straight in and ask you, and it's a lovely feeling to have, in that you are very much trusted by them for the health needs of them and their families.